Hi, my name is Mitch Burridge from the University of Central Queensland, and this is my presentation on placebo effect on upper and lower body skeletal muscle strength and endurance, psychological influence on college-age students. A placebo is a substance or treatment that is given to patients or participants that is ineffective and therefore should not produce any physical effect. However, an increase or improvement in the placebo group is often observed together with the effects on the experimental group. This is known as the placebo effect. It's used to increase sporting performances through such sports as cycling and running. It has widely been used for increased force production in strength training. Placebos have been used to help with medications like Parkinson's disease, as well as help treat anxiety, depression, and sleep. There are some restrictions with the placebo, such as belief or lack of belief in what the substance is being supplied by a sports physician, researchers, or doctors. Also, the relationship with physicians or healthcare providers. It has been shown that the better the relationship is between the physician or healthcare provider, it is the higher chance of the treatment success. Ethics and ethical guidelines need to be taken into consideration when conducting experiments with the placebo. Our aims for the study to examine the effects of skeletal muscle strength when implementing a placebo, using two types of variations, the bench press and the leg squat, and we identify these changes between baseline, trial 1 and trial 2 testings. Our participants, 15 college-aged men who are apparently healthy, volunteered to participate in this study. Subjects were informed as to the experiment's procedures, signed informed consent statements and medical history forms, and adhered with National Ethics Statement approved by Central Queensland University prior to any data collection. Our study design, at each participant had a familiarisation session to become comfortable with each exercise. Each participant performed standard warm-up protocol before each trial through the testing phase. Prior to all muscle strength and endurance tests, subjects were advised to utilise proper lifting techniques according to the standards set forth by the National Strength and Conditioning Association. Each participant was to record a food diary for 3 days prior to baseline testing. At baseline testing, all participants completed the standardised warm-up and completed 1 RM and muscle endurance tests for bench press and squat exercise using identical procedures to the ones performed in the familiarisation testing. After they each completed the baseline testing, they were given another food diary and also given a 4-day supplement of sugar tablets, but were informed that the tablet composed of a powerful amino acid compound that has been proven to increase skeletal muscle strength and endurance. Subjects were instructed to consume the supplements 3 times a day and were given a supplement adherence log to complete to ensure the supplement was being used properly. The testing 1. Subjects then completed 1 RM and muscle endurance tests for bench press and squat exercises using the identical procedures they performed during the baseline testing. Following the testing, subjects were given another food diary to complete 3 days prior to their next training session. Subjects were also given an additional 4-day supply of supplements provided after baseline testing. This time, supplements were informed another university just completed an independent study of the supplement and found the supplement to have no effect on the skeletal muscle strength or endurance. Subjects were instructed to still consume the supplement 3 times per day and were given a supplement adherence log to complete to ensure the supplement was being properly consumed. Into trial 2. Subjects then completed the 1 RM and muscle endurance tests for bench press and leg press exercises, again using the same identical procedures. After all subjects completed all aspects of testing, an experimenter contacted each subject via phone and informed them of the purpose of the investigation. All subjects were also told the supplement they consumed during the phase was testing was a sugar tablet. Our performance outcome was to see the effects of the bench press and the leg press exercising, followed by the previous mentioned protocol. The statistical analysis using dependent paired t-tests to estimate the statistical difference when comparing baseline, trial 1 and trial 2 across 6 exercise variables. Additional repeated measured ANOVA were used to conduct a 95% prediction limit on the data. Also, a 2 post-hoc was completed. All statistics analysed were used by the Excel data analysis. Also, our p-value, our alpha level value was set at 0.05. Here we found a significant difference between baseline 1RM bench and trial 1RM bench, and between baseline 1RM bench and trial 2. We also saw a significant difference in baseline 80% bench and trial 1, and also baseline 80% bench and trial 2. We also found a significant difference baseline squat 1RM and trial 1, and between baseline squat 1RM and trial 2. Also found a difference between baseline 80% squat and trial 1 and baseline 80% squat and trial 2. Our last graph, we found a significant difference between baseline squat reps at 80% and trial 1 squat reps at 80%, and between baseline squat reps at 80% and trial 2 squat reps at 80%. However, we found no significant difference between baseline bench and trial 1 and between baseline and trial 2 in 80% bench press. The purpose of the study was to investigate the placebo effect on upper and lower body skeletal muscle strength and endurance using a group of college-aged men. The data found that the introduction of the placebo effect did increase the performance throughout all trials within the squat variation. The data also found that the introduction of the placebo effect did increase 2 out of 3 bench press variations, with the 80% bench press reps showing no statistical difference between the trials. It is also shown that there was no significant difference between trial 1 and trial 2 in all variations of the bench and squat, even after the participants were told that another university just completed an independent study of the supplement and found the supplement to have no effect. The findings of the study supports our alternative hypothesis that the application of the placebo will see an increase in physiological response and will improve performances, which is also supported by Calcitanis 2007 study. The results we found have similar findings to past research, where they found an acute increase in force production while completing leg press and bench press exercises, also inducing milk sugar tablet, placebo, and false information regarding the supplement. Coliguri and Vokes confirmed our findings that the participations performed was produced by the placebo effect because of the belief the participants had in the supplement they were given. They also noted that participants that believed they were given performance-enhancing supplement, they saw an increase in not only strength performances, but in cognitive performances as well. Maganaris and Bede both note that the use of false information with supplying placebo could very well be a possibility for future in regards to limiting the use of banned substances across a wide range of sports. However, does admit while this could be a possibility, it would be hard to do a high-level athlete. These substances offered by their coaches would be on the banned substance list. Ethical guidelines must also be taken into consideration when dealing with the possibility of performance-enhancing drugs. Emotions and physical and psychological aspects when working with patients or athletes. While there is some debate over the support from some researchers over the prohibition use of deceptive placebos for precaution reasons, others debate that the use of placebo or deceptions of placebo should still be common use of practice for when it is benefit for the patient or athlete when there is no physical or psychological damage. We have the practical application. It would benefit in many fields from sporting arena to psychological benefits that athletes and general public get from the use of placebo, to researchers looking at comparing the effects of nutrition supplements. The use of placebos with athletes would hopefully limit the use of performance-enhancing drugs within the sporting field across the globe. Thank you.